Good morning, everyone, and thank you for joining us for our regular COVID-19 briefing with Chief Public Health Officer Dr. Heather Morrison, who will give us the most up-to-date information on the COVID situation in PEI. Just to begin, we're in a much better situation today than we were this time last week. And while we have 47 active cases in the province, we're confident that the West Royalty outbreak situation appears to be contained and the appropriate individuals are in isolation to assure that there's no further spread related to these cases. I also wanted to talk today about a couple of measures that we have talked about in the last briefing or the last couple of briefings. First of all, with our vaccine or test policy, as I indicated last week, various departments and agencies have been working collaboratively since our announcement about the implementation of a vaccinate or test policy for those government workers in vulnerable settings such as classrooms, correctional facilities, group homes, and early learning centers. This policy will come into effect Friday, September the 24th for the specified settings. Each department and agency are operationalizing this policy based on the factors that are unique to their individual workplaces. This new policy will see individuals who work in these settings who are not vaccinated tested between 1 and 3 times per week, depending on their work schedule. These tests will need to be witnessed and a negative test result recorded. The Chief Public Health Office will be able to request this data at any time to review an audit should they feel compliance to the policy is not being upheld. And just to be clear, we remain committed in our desire that every eligible Prince Edward Islander get a vaccine, to get double vaccinated, in particular those who work with vulnerable islanders. And until we get there, people who work with vulnerable islanders will need to be vaccinated or require regular testing to provide the highest level of protection that we can offer. The other issue we have been talking about is a vaccine passport. As a province, we have been working with our provincial neighbours in Nova Scotia and New Brunswick on a proof of vaccine credential, most commonly known as a vaccine passport, in which we will for good, bad, or other, refer to from here on in as a PEI Vax Pass. In the last couple of days, we've been working with our counterparts to ensure we have as much alignment as possible within the region. The Vax Pass program will be time limited. That will lift when the risk of outbreak is reduced, with measures such as when our children 5 to 11 are vaccinated to protect them from serious health outcomes. This Vax Pass program will apply to indoor and outdoor gatherings and events, restaurants, sporting events, concerts, wedding and funeral receptions, essentially any place where large gatherings will occur. The program will not be applicable to worship or religious ceremonies or funeral and wedding ceremonies, nor will it be required for retail, banks, or access to healthcare services in the province. And there will be lists of where this will be required and where it will not be required in the days ahead. It's our intention to implement this program and have it go live on October the 5th. And obviously, as I say, there will be exemptions to the Vax Pass program, such as individuals who are not eligible to be vaccinated, like our under 12 population, or those who have a medical exemption. There's an interdepartmental working group that is meeting with stakeholders across the province to ensure as smooth a rollout as possible in the coming weeks. The Vax Pass program, like all of the programs that we have initiated through the COVID outbreak or the COVID pandemic, will evolve over time, especially from a technology perspective. It will start with individuals providing a paper copy of their vaccine record for establishments or settings who are requiring a vaccine passport based on their operational plan. And we hope to have the testing complete on what is a QR system with your phone by early October and be able to roll out the technology to applicable settings over the latter part of October. So there'll be more details shared in the coming days, of course, as we continue to work out exactly how this will work. But again, it is our intention to go live with the required PEI VaxPass on October the 5th. So with that, I will turn it over to Dr. Morrison for a more detailed brief on COVID, and then we will open up, of course, like we always do, to questions from our friends in the media, both who are here and those who are joining us on the phone. So over to you, Dr. Morrison.
Thank you, Chair. I think it's good afternoon now for sure. Thank you for being here for this briefing. I'm going to speak briefly to start with about the West Royalty outbreak and then more about the COVID epi in terms of an update as well as vaccine. Today there are 3 new cases to report in PEI. All are contacts of previously reported cases, and 2 are household close contacts related to the West Royalty Elementary School outbreak. 2 individuals are in their 30s and 1 is in their 20s. Contact tracing is complete and they are self-isolating. We have 47 active cases and 287 cases since the pandemic began. As one of our team members said earlier today, and the Premier said it as well, we are in a much better place today compared to where we were a week ago. And the fact that we can say that is, according to our epidemiologist, frankly amazing, and due to a lot of work and really a big impact on a lot of people. This time last week, we were just beginning to understand the extent of the COVID-19 outbreak related to the West Royalty Elementary School. And thanks to the tremendous support of students, families, the education system, and our partners at Health PEI, we are confident that we're moving in the right direction to contain this outbreak. It is still early days, and this outbreak is not behind us, and we may have more cases in the coming days. Last week, the decision to act quickly and close all schools in the Charlottetown area for a 3-day period appears to have been key in helping us to contain the spread of COVID-19. This short closure gave individuals the time to be tested. It allowed the staff the opportunity to conduct contact tracing, and most importantly, it provided public health with critical information about the extent and scope of spread of COVID-19 in our community. Since the beginning of this outbreak, public health has been focused on the basics of outbreak containment: testing, early detection, contact tracing, follow-up, and isolation. In the last week, 38 cases of COVID-19 were diagnosed in PEI, our highest weekly count to date, and 2.4 times our previous weekly high of 16 cases. There are a total of 29 cases related to the outbreak at West Royalty Elementary School. 24 cases are children, and 5 cases are adult household contacts of the children. One of the cases linked to West Royalty is a student at École La Belle Cloche. The close contacts of this case were tested, and the results were all negative to date. Similar to other close contacts, these individuals will remain in self-isolation for 14 days and be retested. 580 close contacts have been identified in relation to the West Royalty outbreak and the cases at Charlottetown Rural High School. And I know we spoke about it last week as well. There are always questions about regarding close contacts. And close contacts are tested at least 3 times after being exposed to a positive case of COVID-19. The initial test at day 0 to 1, and we do not expect this test to be positive, but it does serve as a baseline. Day 4 to 6, where we expect to pick up most of our positive cases among close contacts, and again on day 9 to 11, where we still have between 2 to 9% of our cases who turn positive. For instance, 17 close contacts were identified related to this West Royalty outbreak who were in isolation for at least 48 hours, meaning they had no opportunity to spread the virus to others. And also, if close contacts develop symptoms between testing intervals, they are directed to be tested immediately. And given the fact that 20 to 40% of cases never develop symptoms, it is important that we maintain a combination of testing and isolation protocols for all close contacts. Over 7,000 lab-based tests were conducted last week. 51% of these tests were in individuals under the age of 19 years. In addition, over 11,300 point-of-care or rapid tests were conducted last week, and just over 3% were in individuals under age 19. We have been asked, when will the West Royalty School outbreak be officially over? The outbreak will be declared over at least 14 days after the last case associated with the outbreak was diagnosed. Despite widespread testing, we have not been able to link any of the school-related cases to travel outside of the province. We know that COVID-19 is circulating in our community, making it extremely important that anyone who is experiencing symptoms of COVID-19, even mild ones, to be tested as soon as possible and to stay at home if they are not feeling well. Although we have reported 54 cases since the beginning of September, we do remain fortunate in PEI when we look across the country. Our rate of cases per 100,000 population remains the lowest of any jurisdiction in Canada. So if you look at PEI's rate of total cases, it's 178 per 100,000, and Canada is 4,162 per 100,000 for overall Canada. The COVID-19 situation in the rest of Canada in some ways is similar to PEI because they're seeing an increase in cases. Overall in the country, a 16% increase in new cases. In Atlantic Canada, cases are also on the rise with 645 new cases in the last week and 714 active cases in the region. The national modeling indicates we are still in the early stage of the fourth wave that is being driven by the highly infectious Delta variant. It is predicted this wave will have a greater impact on healthcare systems across the country. Health systems in other jurisdictions are becoming overwhelmed as a result of COVID-19 hospitalizations. It is disturbing to hear frontline health professionals pleading for help in other parts of the country to provide direct care for people who are critically ill with COVID-19, and also their heartfelt requests for additional public health measures to limit the spread and impact of this virus. Nationally, hospitalizations were up 23%, ICU admissions up 22%, and deaths up 22% in the last week. New cases, hospitalizations, and deaths are occurring primarily among unvaccinated individuals. Since December 2020, over 84% of hospitalizations are in people who are unvaccinated, and less than 2% are in individuals who are fully vaccinated. As we've said before, COVID-19 is an agile virus that spreads very easily among unvaccinated individuals. The average weekly rate of hospitalized cases in unvaccinated individuals is 39 times higher compared to fully vaccinated individuals. All of the PEI cases sequenced by the National Microbiology Lab in September have been confirmed as the Delta variant. We are awaiting sequencing results on some other samples, but we expect they will be all the Delta variant. Throughout Canada, now 98% of the cases are Delta variant. As we are witnessing here in PEI, the Delta variant has a breathtaking ability to spread. Others have described it as spreading like wildfire, being transmitted quickly with very little contact. This variant is a game changer. The measures we were taking to contain the spread of COVID-19 earlier this year are not sufficient to fight this variant. The best way through this pandemic is for as many people as possible to be fully vaccinated as soon as possible, but also to continue with our other public health measures. On an individual level, it's important that we each take steps to limit the number of our close contacts and focus on keeping our circles small. As much as we all want life to get back to normal, we cannot let our guard down against this Delta variant. Like other jurisdictions, we are aiming for a high rate of vaccine coverage across all eligible age groups, especially among those aged 12 to 39. There are just under 40,000 people in PEI who are not fully vaccinated, including 19,000 children under the age of 12 years who are not eligible to be immunized against COVID-19. As of Saturday, September 18th, a total of 250,223 doses of vaccine have been administered, and 92.8% of the eligible population have received at least one dose of vaccine, and 85.1% of eligible island residents aged 12 and over have received 2 doses. However, the rates of fully vaccinated eligible residents aged 12 to 40 is still less than 80%. And I do expect that number to increase, those numbers. Health PEI vaccine clinics are accepting walk-ins, meaning no appointment is necessary, and a number of partner pharmacies across the province are offering mRNA vaccines to people over the age of 18 years. Please check the provincial website for information about getting the COVID-19 vaccine. We continue to receive questions regarding a booster or third dose of vaccine for certain groups. We have adopted the recommendation from the National Advisory Committee on Immunization regarding individuals who are immune compromised. People who are immune compromised may not mount a full immune response to the COVID-19 vaccine. And island residents who have received 2 doses and are moderately to severely immunocompromised can receive the 3rd dose of the COVID-19 vaccine at a participating pharmacy or at a health PI vaccine clinic. If you are unsure if you meet the definition of immunocompromised, please visit the provincial website for more information or speak with your healthcare provider. The National Advisory Committee on Immunization is reviewing data to determine if a booster shot is needed for other groups. I've had discussions with my colleagues in other provinces regarding the feasibility of giving a 3rd dose to residents and staff in long-term care to boost their immunity. Most of these individuals were fully immunized by mid-February and over 7 months ago, and I'm hopeful we will soon be in a position to offer boosters to residents and staff in long-term care in conjunction with the influenza vaccine. I'll just take a little note about something non-COVID. This week is National Environmental Health Week, time to recognize the skills and contributions of environmental health officers in PEI and Canada. Environmental health officers, and there are many who work in the Chief Public Health Office as part of our team, are public health professionals dedicated to protecting and promoting the health and safety of islanders and communities. And they've demonstrated their expertise throughout the pandemic. They have stepped up and answered the call to play integral role as part of our provincial pandemic response. And they are involved in everything from screening at the points of entry. They do COVID-19 inspections and review operational plans. And they work with partners and sector representatives to operationalize COVID-19 measures and provide guidance on infection prevention and control. And these responsibilities are in addition to their regular duties in ensuring our water, food, air, and communities are safe. So thank you to environmental health staff for your dedication and commitment to keep Islanders safe. We knew the last part of the COVID-19 journey would be difficult, and we focused on preparing for whatever challenges the virus presented. I heard someone describe it recently as, we talked about it before, the light at the end of the tunnel, but all of a sudden, as we go into the fall, the tunnel seems to have gotten a bit longer. We can still see the light there, but the tunnel is longer than we had hoped for. The Delta variant is now the dominant strain and is much more infectious. At a population level, we know the vaccine is effective at protecting people from hospitalization and severe outcomes related to COVID-19, including the Delta variant. But we know that no one measure is 100% effective against the Delta variant. We will be maintaining border measures, including testing, screening, and isolation for unvaccinated individuals. We will maintain and strengthen our capacity to conduct contact tracing and follow-up. The last week was a stressful and frankly scary time for many families. It was a reminder how quickly this virus spreads and the impact an outbreak has on families and communities. Being in self-isolation is never easy, and it is especially challenging for young children. Thank you to the children and their family members who are in isolation. Thank you to all Islanders who are supporting the many families who are self-isolating. And Oh, if there were a couple of key messages, I feel like I keep repeating. If you've not been vaccinated, please visit a vaccine clinic as soon as possible. And if you've only received one dose, please arrange to get your second dose at least 28 days after your first dose. And if you have any symptoms of COVID-19, even if they're mild, please arrange to be tested at one of the testing clinics. And until we have, as a country and as a province, sort of gotten through this fourth wave and have more people vaccinated, certainly consider whether or not you need to travel. And if you do travel, please follow the public health measures and take steps to protect yourself and others. And as we continue our journey through COVID-19 together, let us continue to be patient and continue to be kind. Thank you.
Well, thank you very much, Dr. Morrison, and encouraging news for sure. And now I will turn it over to questions from our friends in the media, in particular those who are here live. So please go.
Good afternoon. Thanks for taking our questions. I guess to start, I was just hoping to get a little more detail about the vax test policy coming into place. You know, being tested 1 to 3 times per week, will it then be up to the employer to sort of monitor and record all of that? How is that going to work?
Do you want to start and then sure. Yeah.
Probably it'll be, so I think it'll function a little bit differently depending on which department is involved in. The Premier mentioned there's Department of Education and Early Childhood, there's Department of Justice and Public Safety, Department of Family Social Group Homes, so a number of areas. So what the test kits are, the rapid antigen kits, they will be delivered to the different sites that need them. And again, how they put it all in place will really be up to those departments. But for instance, if you only do 1 shift a week, you might be tested once. But if you're doing a couple shifts, you may get tested twice. So it'll depend a little bit. Your frequency of testing will depend on your work schedule. And certainly I think the number of people requiring testing will decrease as we have more people vaccinated, and I think that's certainly the goal. It's one more measure. We know that we've just talked about the majority of Islanders are fully vaccinated, and this is just one more measure because we know that we want to decrease the risk of who has COVID, but also the decreased risk of spread. So it's we've already implemented it in long-term care and community care, but this is really being a policy is being put in place by the various departments to try to collect that information and ensure people are vaccinated or tested.
And my next question is about the vaccine passport, and just, you know, October is actually just right around the corner, which is crazy to say at this point, but you know, I'm just wondering if do you have enough time to get everything in place that you need to be able to ask for that in certain places? And I guess how are you preparing those businesses or event organizers to do this once it rolls out?
As I say, there's been a working group that has been working on this. We didn't just start this morning. I mean, this has been ongoing for a while. And as I've been saying, and Dr. Morrison has been saying, you know, we were really the first jurisdiction to really implement a vaccine requirement with our PEI pass. So we have a considerable amount of experience in doing this. Now, how it impacts each individual business or organization, that's kind of how we're trying to work through this and roll out and get as much input with stakeholders as possible. We want it to be as efficient as possible, and it will become more efficient once we get the electronic component of this in place, which we hope to have, as I said, toward the middle or latter part of October. But you know, we are in the midst of a fourth wave with a highly contagious Delta variant that is spreading through the country and beyond, and has been on our shores. So we know we need to act quickly as we move more indoors with the fall coming and then the winter beyond that. So it's, as I say, we've been working on it for a while. We have a couple of weeks to implement it. Other jurisdictions are on a similar time frame, such as Nova Scotia and New Brunswick, for example, and we're going to try to make it as collaborative as possible across the board. And but I think it's like everything we've done in COVID. It will evolve. It will take a little bit of time. There will be many more questions than we have answers for in the beginning, and we will find a way to work through it.
I just would add, because I've heard you say, we have the chance to really learn a little bit from the other jurisdictions, because other jurisdictions have already announced this. So I think it's a chance to have certainly learn from others as we put this in place. And anything we can do to avoid lockdowns or, putting more people in isolation, I think, because we want people to continue to have activities, et cetera. And if this can avoid how many people might end up in isolation or stopping activities altogether, I think that's, partly, I know I've heard the Premier say that.
And I have one question about West Royalty, the situation at West Royalty. Just about, over the weekend, a release went out that said some people were testing positive on their second test or even subsequent tests after that. So I'm just wondering what you would say to anybody who had concerns about students returning to class and whether or not that was happening too quickly.
Well, I think so. Thank you, and I think that's why I tried to take a few minutes to clarify some of that in my long-winded notes, because I think I was trying to address that. Because if you have people in isolation as close contacts and they test positive after their first or second test, it means that we would expect. That's why we identify close contacts, because they could test positive on a subsequent test. So it indicates to us that those who are in isolation, we may have certainly identified the people who are close contacts if that happens. And it also emphasizes how important it is, if we've said to isolate, you need to isolate so that that doesn't happen. And because if you turn positive and were previously negative and you were in isolation, you can't have exposed other people. So that's really the goal for that in that school. So it's not surprising that people will test positive, but the people who are testing positive are those who are in isolation at this point, and that's what we've seen the last number of days. So a lot of work by public health, nursing, the testing clinic, the team in the office to try to make that happen, and over the last week.
I actually just have one really quick follow-up. During the pop-up clinic at West Royalty, teachers and staff that were partially vaccinated or unvaccinated were asked to come to the pop-up clinic and get tested. I guess why weren't fully vaccinated teachers and staff asked to also be included in the testing?
Well, I think many of them were also tested too. We certainly were seeing the cases in terms of the outbreak happen in students, and that's really where our focus was. The students at that school were not able to be vaccinated. They are an unvaccinated group, so really important to try to test them all. But we certainly were saying anyone with symptoms, and that's consistent with what we've been saying all along. So.
Thank you. Mr. Stewart?
Thank you very much, as always, for taking our questions this afternoon. And this question might build on what Brittany just asked, but are we seeing more negative tests at the border or with the 6 recent cases? Is that because of the Delta variant? She may have asked that question. I'm just looking for some clarification on, are we seeing more negatives first and then they test positive?
I don't think we've seen more. We've had that happen throughout the pandemic. I just think we've had more cases in the last month than we've had before in any other previous months. So I think we're just hearing about it more, and and we know the Delta variant is very contagious and infectious. So we have a lot of people in isolation, but they are certainly their initial test may have been done so early they were still incubating, and then they turn positive. So I think it's something, it's the reason we've had people in isolation for 14 days since the beginning of the pandemic, knowing that people can turn positive after incubating the disease after exposure.
Okay. A follow-up question would be, I think public health had gone into the school system in the spring to inoculate eligible students. What about the students who may have been missed, or students who have turned 12 since? Does public health have any intentions of going back into the schools to get those missed children?
So anyone who's, I guess the two parts to that question. The first is anyone they've had a first dose, they are following up to get a second dose, and so that will happen. They're also looking at if they're going into school to do other immunizations for other school-based immunization programs, then they will also see if they can do additional COVID vaccines for anyone who might not have been vaccinated. Those who are turning 12, of course, they're spread out across the province, and there'd only be certain ones at certain schools. I've been encouraging parents to book their appointment on their 12th birthday. I'm not sure every 12-year-old wants that as their birthday gift, but I certainly strongly encourage that. So I guess a variety of things trying to support that extra vaccine access. The other thing that we're looking at is if there's a school, for instance, that has school rates that in that 12 to 15 age category, for instance, that are lower than we would expect, then we would see if we could set up a clinic in that area for the children and perhaps their parents, so to see if we can help access there. So we're just trying to work with public health on some of those.
Okay, I guess one more follow-up question. You've said, Dr. Morrison, before that you're not comfortable with just our numbers are high in terms of how many Islanders have been vaccinated, but you'd like to see it higher. We'd all love to see it at 100%, no question. Has the province, has your office given any consideration to a vaccine mandate, to mandating it?
I think, the Premier probably could answer this, but I think from my perspective, we're doing a lot of things to certainly encourage and support vaccination. And I think the Premier certainly announced 2 other measures to increase, that may serve to also increase our vaccine uptake. But at this point, I think there would be nothing further from my point of view.
Yeah, look, we have tremendous uptake for Islanders. The numbers that Dr. Morrison has talked about here earlier are, as good or better than most jurisdictions in the country. So we've had a tremendous uptake. I think there's some remaining Islanders who remain a little bit hesitant that I think will go and get vaccinated, because as we're seeing across the country and beyond, that life will be different for those who aren't vaccinated for the short term. And I think it's also in the best interest of everyone to go and do so. But I think there's also a percentage of the population that are opposed to vaccine. And I'm not sure if me saying you have to get this would change anything from that perspective. I think what we're trying to do with our PEI Vax Pass and with our, get vaccinated or test policy for frontline services from government is to say that, these are the realities of what we're dealing with right now. Nobody wants to have to deal with what we've been dealing with. We all want to go back to normal, so we don't look and say, are you vaccinated, are you not? We'd like to go back to some kind of normal life, but until we can get there, our job from the beginning remains to do the best we can to keep as many people safe as possible, and these are the measures that we haven't put in place. But I'm not sure there's a percentage of the population that if we said you need to do this, it's going to change the result.
I could just
Sure.
one more very quick question in there. With the Vax Passport, I have a PEI pass. I have my immunization record that shows I'm double vaccinated. The passport's going to be something completely different that Islanders will have to apply for, will be issued to us. Just, do we know what that's kind of going to look like logistically?
Those are some of the logistics I believe the committee, the working group is looking at. Or that's my understanding. They're just trying to, we have so many Islanders who have, have a PI pass. But it also may be something that if at some point when we move to a QR code, is it easier at the point of entry to show the QR code than haul out a piece of paper? So anyway, those are things that I think the working group is certainly considering, and that's part of the operationalizing of this in the next couple of weeks.
Yeah, and I haven't sat around the operational meetings to figure out what exactly they're discussing, but I do know that they're working to make this as efficient, as easy as possible, and whether or not, your vaccine passport that you have through your PEI pass will be something similar to that, or I think that's the logistics that they're working on. And as we roll closer to October the 5th, we will be sharing more information about what that all looks like. But
Thank you very much.
thank you. And we have some callers on the line, I'm assuming.
Steve Bruce, BBC.
Good day to you both. A question for Dr. Morrison. Seeing a lot of cases popping up in New Brunswick in particular right now. How much does the situation there concern you, and I guess what that could mean for PEI, given they're just right across the bridge?
Hi, Steve. It actually does concern me, and I've been talking about this with the team as we watch this over the last couple of weeks. The numbers increase, and a couple of things. One, it speaks to some of our advice around travel and some of our cautions around making sure you're immunized, following public health measures, and do people really need to go at this point in time? And but it also, we spoke last time about the extra measures we'd be doing for testing of children who are not vaccinated when they return, and asking them to be on a testing regimen when they come back, knowing that there's lots of movement between PI and other maritime provinces. We've also asked at the points of entry to do some additional testing of New Brunswick residents, or whenever possible. Sometimes it's just in terms of volume of people coming in, that's a challenge, but they have implemented that as well. It is a concern, but so is the whole country looking at the increase in cases, and that's why I think we put all these measures. Not a single measure is enough. It's not an armor to have it at just the points of entry. We have to have other measures, and I think the Premier has talked about a couple of additional measures that we'll try to put in place to keep our residents safe. And that's our responsibility here, to try to protect Islanders as a whole the best we possibly can. And I know other provinces are trying to do the same thing.
Yeah, what your recommendation is for travel off island? I believe the website says it's not recommended if you're traveling for non-essential reasons. Is that just so for those that aren't vaccinated? Do you have a different set of recommendations if you are fully vaxxed?
I think at this point in time, even I think it's certainly for those who are unvaccinated, but I think we said last time, if you don't need to go to Costco then maybe you could shop here. But there's lots of things. There's people having to visit. They have to see loved ones. They have business. They have work. They have meetings. There are certain tournaments that I know are taking place in a couple of weeks. We've given guidance that has said that whether you're vaccinated or not, if you're participating in the tournament, we are giving a testing regimen that we think is important for when they come back, and actually testing before they go, because we don't want to also be responsible for spreading COVID. So those are things that need to take place and should take place, but it's just that consideration about is now the time to travel, really, frankly, anywhere if you don't really need to go.
And just one follow-up. Do you have a sense of how long the testing of children under 12 at the border, how long that will stay in place? Is it just until things calm down? Do you have criteria for that?
Well, I think for me it would be looking at what's happening in terms of the fourth wave across the country. We'll continue to be monitoring the impact on children of COVID across the country, and certainly watching with interest when we may be able to vaccinate our children, not only here but across the country.
Okay, thanks so much.
You're welcome.
Thanks, Steve.
Gabrielle Drummond, Radio Canada. Good afternoon to you both. Dr. Morrison, ma question c'est en français. Hier, Pfizer et BioNTech ont annoncé que leur vaccin fonctionne pour les enfants de 5 à 11 ans. Alors, j'aimerais savoir quand est-ce que vous pensez que ce vaccin il va être approuvé pour cette tranche d'âge ici au Canada et à Lille, et dans quelle mesure la vaccination de ce groupe d'enfants pourrait justement aider à freiner la propagation du variant Delta pour qu'on puisse vivre normalement à nouveau.
Bonjour Gabrielle, et puis c'est ça, on veut tous, je sais qu'on veut tous vivre un peu plus normalement que maintenant. Alors, après que Pfizer va mettre ses études et faire comme une soumission au Santé Canada, et puis ils vont regarder les études et l'évidence. Et puis, il y a un processus pour approuver un vaccin au pays. Et quand ils annoncent ça, le comité sur les vaccins ici au Canada, NACI, vont aussi faire une recommandation. J'imagine qu'ils vont faire la soumission peut-être dans quelques semaines, et puis on va peut-être on va savoir si c'est approuvé à quelque temps cet automne, mais j'imagine qu'on va pas avoir que c'est pas ici avant le fin d'automne, premier d'hiver, mais c'est difficile à donner une date. Mais quand ça arrive, est approuvé, on va chercher le vaccin pour les insulaires, les enfants ici.
Ma deuxième question, c'est par rapport au passeport vaccinal. Je pense que vous avez répondu en anglais, mais j'aimerais que vous me parliez, s'il vous plaît, de ça en français. Donc, le passeport vaccinal, est-ce qu'il va remplacer la PIPS, et comment les gens des autres provinces pourront avoir accès à ce passeport vaccinal de l'île? Alors, qu'est-ce que vous pouvez nous en dire là-dessus?
Et bonjour, c'est même réponse vraiment en anglais que c'est une chose qu'ils en discutent. Il y a un comité qui travaille là-dessus, et ils discutent qu'est-ce qu'ils vont faire, si cette passe va remplacer le PI Pass ou non, ou si c'est complémentaire. Alors, on va voir les détails, qu'est-ce qu'ils vont décider. Et puis, je pense que je viens de doubler la deuxième partie de votre question.
Comment les gens des autres provinces
oui.
vont faire pour se procurer?
Oui, alors c'est vraiment, on veut que, et ça c'est pourquoi c'est important, et le Premier ministre a mentionné, c'est important de travailler avec les autres provinces parce que on veut que notre passeport vaccinal peut être utilisé à Montréal et aussi que leur passeport vaccinal peut être utilisé ici. Alors, c'est plutôt que ça, on peut reconnaître, et je pense vraiment comme on a notre permis de conduire de l'île du Prince-Édouard. Mais si vous présentez ça à Québec, ça va fonctionner comme permis de conduire. Et je pense que c'est la même sorte de chose avec le passeport vaccinal, que ça peut fonctionner dans les autres provinces. Je pense et j'espère que ça va fonctionner comme ça.
OK, excellent. Merci beaucoup.
Merci. I might say that last part in English just to translate that last question. It was about how would someone else from PEI get a PEI Vax Pass? And I think the details are being worked on by the group that's working on this, the working group. But I think about it as every province that is implementing this will have their own version, almost like your own driver's license, that it's still recognized in another province. Because I want Islanders to be able to use this pass, or I hope, and I think the committee wants this pass to be able to be used if they go to BC or Ontario, just like if someone's visiting us as a tourist from BC or Ontario, that they are able to use it here. So I think that's why it's important to have some alignment with other provinces on this. So.
Well, thank you very much, Dr. Morrison. I think that brings an end to the questions and answers, and to our friends in the media who I know probably stayed up way too late last night watching the election results. Thank you for your questions today, and the best of luck in a sleep-deprived day ahead. So thank you very much.
Coffee sales and teas with Muslim.
Yeah.